Welcome to video number 2. Today we're going to talk about nutrigenomics, and this is a crucial topic. In fact, most people could spend an entire weekend's conference or perhaps a week just getting into the details of this. But I just left actually Starbucks a little bit earlier, getting something healthy, and I wanted to tell you about a lady that was just in front of me because it was so apropos for this. As she was standing there, I could tell that she was clearly dealing with some type of cancer. She had a chemo bag that she was taking in. She had lost a significant amount of weight. Her hair was very thinned, in fact losing it. And I just was thinking about the aspect of nutrigenomics and cancer. And so I want to really lay out for you some crucial elements about nutrigenomics that can change our life. In fact, I would say it like Dr. Russell Blaylock, secrets that can save your life in nutrigenomics. So this is the exciting part about nutrigenomics. And in that example that I just told you with the lady that I just witnessed at Starbucks, we want to think about some of the most crucial processes in our body, our metabolic processes. And these are the ones, when you talk about small hinges that move big doors, this is probably as small as you could possibly get. We're talking about inside your DNA. In fact, we could even say, what is your DNA telling you? Your DNA is actually altered by foods that you take in, can be, and even what those foods break down into, their nutrient bases. So when we talk about this, I want to tell you one area, and that's vitamin D, because this is one of the most crucial areas. Now, we live in sunny South Florida, and so everyone would think that the sun is giving them enough vitamin D conversion in their body. But this is one of the areas that epidemiologists have shown in research. They project that up to 250,000 cases of cancer would be prevented. That's right, I'm saying that again. 250,000 cases of cancer would be prevented, colon, breast, and prostate cancer, every year in the United States alone and Canada, United States and Canada alone, if vitamin D levels were in an optimal range. How crucial is that to understand for cancer prevention and for your overall health and well-being? And so when we see people coming in South Florida, triathletes, runners, athletes of all sorts, when they come in and we get their vitamin D levels tested as a part of our overall profile, and their vitamin D is at the very bottom of normal, we realize, based on those studies, we can help improve their nutrigenomic protection to their overall system. So that is the science. And I know there's a lot of big words in that, and it's a mouthful and it's a headful, but I need you to consider thinking differently. And this is really where it starts, thinking differently. If in the past you thought you could just get it from sunshine, the vitamin D, or I just get everything I need from my food sources, if you're up to any of the specs that people are today, you realize just with a little bit of reading, most of our food supply, whether it's meats, whether it's vegetables and produce, all these things, they're not quite as healthy as we would hope they would be. So we need to think differently. So what does this mean to us? This means that we need to start to consider when we want to prevent disease, and that's really where we want to start, right? An ounce of prevention is worth a pound of cure. You could finish the phrase for me. So this is where we want to begin. Beginning in the very beginning with your body on the DNA level, understanding what nutrients will affect change in the positive direction and not cause you to spiral into the negative direction of disease and disorder and pain. So we're going to touch on a few more specific elements, and I have several stories that really bring those examples out for you. So my next story, which brings out a clearer picture, that's not so much the science of it, but is more the reality for you and I, is something that a lot of people come to our office already knowing, and that's about genetic testing. What they do is they have their blood tested and they find out what SNPs they might have. That's right, I said SNPs. It's a funny word, but it represents changes in their genome. So people are becoming aware of this through different testing like 23andMe, which you may be aware of. And so by doing this, we can find out where there's some very particular nutrient problems in conversion, like folic acid, for instance, which is a very commonly known nutrient given to a lot of mothers when they're about to become pregnant. So their baby's brain, again, we're back to the brain, will form properly. So testing in this area for 5-methotetrahydrofolate, I know, another big word, but important, helps us to understand when there's very mysterious disorders that people deal with. And now I'm connected with a group of physicians all over the world that practice something called functional medicine. These are medical doctors, osteopaths, internal medicine, medical physicians, rheumatologists, chiropractic physicians, many different disciplines, but they're looking at functional medicine. And we look carefully at these genetic SNPs, if you will, to determine and help people become restored to their healthy lifestyle and their overall health, because these become very mysterious in the illness that they can produce when you become deficient slowly over the course of your life. So methylation and folic acid, I'm just giving you some terms here so you're hearing them for the first time, so when I get back to them, it'll make sense to you. These are crucial elements that help change the profile of your health and things that we'll consider when we work with our patients. So we always say, save the best for last, and so here it is. Now we're going to talk about mitochondria. Have you ever heard of that before? Inside every one of our cells in our body are mitochondria. You can think of them like the engine in your car. They're what generate ATP. ATP is really the currency of life. It's also been said that the mitochondria of our cells is the epicenter of aging. So as the mitochondria create energy for every cell in your body, this is how your body survives, thrives, reproduces, heals itself, goes on in a healthy way. So when we talk about nutrigenomics, we better handle the machinery of that mitochondria in the best way. Mitochondria, when they're breaking down, create oxidative stress. Big words. Also called free radicals. Many of us have heard of free radicals, right? Toxins in the environment, toxins in cosmetics, toxins in our foods. These all create free radicals. Smoke, fumes, many things create free radicals in our body, even normal metabolism. So free radicals are made by the mitochondria. Also, that's normal, right? Our metabolic process, oxidative stress. So I'm saying a lot of things. Don't get confused. Stay with me here. The mitochondria in every one of our cells needs to be taken care of. And this is crucial. Now, let me mention a name to you. Dr. Terry Wahls. She was at the University of Iowa. In fact, she still is. Progressive multiple sclerosis, to the point where she's an internal medicine physician, to the point where she was wheelchair bound. She was non-ambulatory, couldn't walk anymore. The disease was progressing rapidly and taking over her life. In fact, destroying her life and her physical abilities, psychological abilities to care for her patients. She completely turned it around. Now, I didn't say, but I should, that she was following the progressive path of treatment for multiple sclerosis for herself, the normal process in traditional medicine. She completely looked at it from a different perspective. In fact, you could say she thought differently. And she changed her nutrition radically. And so she, even on YouTube and through the internet, you can find TED Talks with her that will tell you about how she did this. And she has designed a protocol to improve the health of the mitochondria, which in her case, not for everyone, altered the course of progressive multiple sclerosis. Now, this is a serious change. And this is possible for us to change the mitochondrial health by altering our diet, by changing the nutrients, by giving our body the fuel that it needs. These are specific things that we consider with every patient coming to us, regardless of the presentation or condition, even for those, maybe like yourself, who just want to perform better, want to improve, and want to prevent the diseases. So, my gift to you here is going to be 12 steps. 12 steps to analyze your nutrigenomics, to give you a map, again, that you need to know how you're going to step through what tests should I ask my doctor for. These are tests that we would provide to our patients, people coming into something that I'm going to mention right here again, our intensive week. You'll want to get more information about that. It's where we take a focused week of a person's life with their participation, and we alter their health as much as we possibly can through the brain, through the nutrigenomics, and what's coming up, mechanobiology, in the next video. Make sure you're here with me because this is one of my most passionate areas, mechanobiology. But make sure you get the download for this, your nutrigenomic 12-step pathway to understand better health. See you in the next video.